Schizophrenia is a brain disorder that generally affects mental functions and behavior. It's associated with a variable course and outcomes range from complete recovery to severe disability. The most prominent characteristics of schizophrenia are hallucinations, delusions, and disorganization, which may lead to dangerous behaviors. More insidious are so-called negative symptoms such as social withdrawal and diminished emotional engagement, and cognitive impairments that can significantly impair social and occupational functioning. Because onset is usually in late adolescence or early adulthood, schizophrenia and related disorders are a leading cause of disability. Globally, schizophrenia is the fifth leading cause of years lost to disability for men and the sixth leading cause for women. Adverse consequences include unemployment, violence, hospitalization, medical comorbidities, and homelessness.
Schizophrenia, it's mean three words: lack of insight. What does it mean, lack of insight? Lack of insight, it means that the patient cannot make a difference between what is the illusion and what is the reality. We can find a patient who's suffering from schizophrenia has some sort of suspicious or paranoid thinking. Paranoid thinking, it means that he cannot make a difference between what he thinks internal in his mind and what he see in the reality in front of him.
Schizophrenia is defined as a clinical syndrome of variable and profound disruptive psychopathology. Actually, that involves an important parts of clients' mental activity. It affects the way of cognition, the way of emotion, the way of perception, as well as it affects the way of behavior. So, schizophrenia is a syndrome. It includes the disturbance of the four important components of the client's mental life, as we said, the cognition, the emotion, the behavior of the client, as well as the perception of clients.
Signs. Schizophrenia is a mental disorder that is characterized by at least two of the following symptoms for at least 1 month. Delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior. A set of 3 negative symptoms. Only one of the above symptoms is required to make the diagnosis of schizophrenia. If the person's delusions are bizarre, if the hallucinations consist of a voice keeping up a running commentary on the person's behavior or thoughts, or 2 or more voices conversing with each other. Positive symptoms: delusions, hallucinations, disorganized thinking, agitation. Negative symptoms: affective flattening. The person's range of emotional expression is clearly diminished. Poor eye contact. Alogia, a poverty of speech such as brief, empty replies. Avolition, inability to initiate and persist in goal-directed activities such as school or work. Although the above symptoms must be present for at least 1 month, there also needs to be continuous signs of the disturbance that persists for at least 6 months. During this period, the signs of the disorder may be present in a milder form, for instance, as just odd beliefs or unusual perceptual experiences. During this 6 months period, at least 2 of the above criteria must be met.
Some of the psychiatrists concentrate on dealing with the signs and symptomatology of schizophrenia and delusions and hallucinations. Delusion and hallucination, one of the main symptoms really. Delusions, when you have a belief that somebody is following me, I believe on that. This is some form of delusions called persecutory delusions. Hallucination, that the patient hearing voices talking to him as a single person or a group of people talking about him. talking about him that he moved, he sat like that. As I have told in the beginning, not only delusion, hallucination, the symptoms of schizophrenia. If we understand the concept of schizophrenia, the patient like a shell, which become gradually empty gradually, that shell, and he loses all of his functioning. It depends on the type of schizophrenia. Simple type of schizophrenia will not find the clear delusions or hallucination, but very clear deterioration of the functioning and the negative symptoms of schizophrenia. Lack of motivation, ambivalence. These are the symptoms, and for that reason why mistaken to have depression, because there is no clear delusion or hallucination. Some form of schizophrenia, like paranoid form of schizophrenia, here sometimes you don't have clear hallucinations but very marked delusions. Even the delusion, sometimes the patient will not tell about it. For that reason, if the patient come alone to the psychiatrist, he will not discover the case. For that reason, I believe if I meet a relative of that patient, he will tell me the story more than the patient himself, because the patient believes that he is normal. Then he will not talk about that because it's a normal issue in his life. Other symptoms in schizophrenia, sometimes the catatonic presentation. What is the catatonic presentation? The patient like frozen, like that, immobile, and no response to stimuli, neither the internal nor the external stimuli. He will not defecate, he will not urinate, he will not ask for drinking or food or anything, and he will not move. This type of presentation usually treated with ECT, the electroconvulsive therapy. Then we have different modalities. The problem also in this schizophrenia, if it's coming with other disorders, and this is a very long story.
Other associated features of schizophrenia that might help the psychiatrist to reach the diagnosis, or even help him in tailoring a management plan for the patient, and might help in the diagnosis and management in general, might include the social skills, or the socializing in general of the individual. You might find the patient with schizophrenia might be socially withdrawn, isolated, doesn't really care or wants to interact with others, usually sits alone, prefers solitary activities. In another sense, he is preoccupied with himself. This might give an indication also and help in the diagnosis of schizophrenia. Other associated features might include the general dysfunction of the individual. He might have difficulty functioning in every area in his personality, for example, in his grooming, in his academic affairs. For example, he might have been a very good student previously, but after developing schizophrenia, his intellect drops, his activities, his academic ratings all drop. So these all might indicate that the individual is actually going into or developing schizophrenia. So these symptoms and features are might be associated with individual with schizophrenia and might help us to diagnose the individual and hence giving him a clear management plan.
For the diagnostic features of schizophrenia, actually, there should be a characteristic features or symptoms. 2 or more of the following should be present for the period of 1 month. Delusions, hallucinations, disorganized speech or disorganized behavior. Of course, the duration could be less if clients are successfully treated. There should be also a social as well as occupational environment of client's life. The symptoms of schizophrenia usually cause a severe disturbance in their occupational or functional status. There should be always a continuous symptomatology for the duration of 6 months. And the features of the illness should not be due to the features of any other mood or schizoaffective disorder. So schizoaffective as well as mood disorders should be excluded. and it should not be due to the effect of substances or exclusively due to the effect of substances or general medical conditions. Such features are very important when we put the diagnostic and statistical manual diagnosis of schizophrenia.
There is main sign and symptoms in all the patients who are suffering from schizophrenia. One of them, you can find the patient started to have delusion. Delusion, it's mean content thought disorder. Content thought disorder, it's mean negative false beliefs. That there is people around him want to kill him. That have paranoid or suspicious that people started to talking about him, or that people referring about him, or people following his steps. This is what does it mean by delusion. Another thing, that there is hallucination, and the hallucination, it's a distortion in perception or sensory perception. You can find that the patient suffering from visual hallucination, that he see a stimulus in environmental or in external environment, and he cannot make a difference between what is true and what is not true. Another thing is that he can hear some voices, and this is what we call auditory hallucination. Auditory hallucination, it means that he can hear voices between whispering, steps, knocking on the door, some sort of screaming in his ear. He started to respond to these voices, and these voices actually non-exist at the reality. And this is important sign and symptoms in patients who are suffering from schizophrenia. Another sign and symptoms, what we call negative symptoms, that the patient who is suffering from schizophrenia cannot give you an appropriate emotions or an appropriate affect during social communication situation. Perhaps you tell him an traumatic news, and he found him or surprised him happy and giving you a smile face, and this is inconsistent with the news. And perhaps you give him a very happy news and found him sad in blunted affect, as you give him a very traumatic news or very sad news. And this is very important. Another thing that you can note in patient who are suffering from schizophrenia, that the patient cannot make a good relationship or interactive or dynamic relationship with people around him. Perhaps also you may find him has an odd behavior like to get awake from his sleep at the middle of night and started to make a while on front of his house without any target or without any purpose. You can also find him that sometimes make lack of interesting of people around him, what we call anhedonia. Anhedonia, it means that he lose of interesting even in himself. A lot of patients who are suffering from schizophrenia spend a lot of time without self-hygiene, without taking shower, without starting to focusing on his external figure. And this is a very important sign and symptoms you have to note it during communicate or evaluate patients who are suffering from schizophrenia.
For the positive symptom of schizophrenia, usually it means the appearance of a newly symptomatology that clients have never encountered before, and it includes the delusions and hallucinations. For the negative symptomatology, it means the absence or the deterioration of already existing behavior. For example, the loss of normal way of expressing emotions, the loss of normal way of relating to others.
If we spoke about the signs and symptoms of schizophrenia, we might find that grossly it is divided into two major components, which is the positive symptoms and the negative symptoms. The positive symptoms are usually the well-known, more clearer symptoms that psychiatrists can notice and the family of the individual can see, or the patient himself can complain about. And these usually involve disturbance in thought in form of having delusions. For example, paranoid delusions or persecutory delusions, and sometimes even grandiose delusions. The patient might find himself having a strong belief that he is being persecuted or being chased or even being watched or under surveillance by a certain entity or group or the FBI or whatever the individual thought might interpret these people to be. Other positive symptoms include hallucinations. The most common type of hallucination associated with schizophrenia is the auditory hallucinations, in which the patient starts hearing voices. These voices might be interacting with him directly, speaking to him, giving him commands, or he might hear voices of people speaking to each other without directly commenting on him. The family might notice the patient speaking to himself with body movements as if he is speaking to someone with him in the room. We call these the hallucinatory gestures. Now, the other types of symptoms are the negative symptoms, in which they might affect the behavior and the thought in terms of the stream or the form of thought, in which the patient might have disturbance of the stream of his thoughts, which might be apparent during his speech or talk. The patient doesn't have the fluency in his speech like the normal individual. He might have thought blocks, he might deviate while talking from one topic to the other. He might have irrelevant answers to our questions, which might be clear while speaking with the individual.
Causes. The causes of schizophrenia, like all mental disorders, are not completely understood or known at this time. There is no known single cause of schizophrenia. Many diseases, such as heart disease, result from an interplay of genetic, behavioral, and other factors, and this may be the case for schizophrenia as well. Scientists don't yet understand all of the factors necessary to produce, but all the tools of modern biomedical research are being used to search for genes, critical moments in brain development, and other factors that may lead to the illness. It has been long understood that schizophrenia runs in families. People who have a close relative with schizophrenia are more likely to develop the disorder than people who have no relatives with the illness. A child with relatives with schizophrenia has about a 10% chance of developing schizophrenia themselves. Recent research has found that people with schizophrenia tend to have higher rates of rare genetic mutations. These genetic differences involve hundreds of different genes and probably disrupt brain development. In addition, factors such as prenatal difficulties like viral infections, prenatal complications, and various non-specific stressors seems to influence the development of schizophrenia. Many environmental factors may be involved, such as exposure to viruses or malnutrition before birth, problems during birth, and other not yet known psychosocial factors. It's likely, although not yet certain, that the disorder is associated with some imbalance of the complex interrelated chemical systems of the brain, perhaps involving the neurotransmitters dopamine and glutamate.
As regards schizophrenia spectrum and other psychotic features, etiology. There is no, still till now, there is no definite etiology. But genetics play a role in these disorders, as all disorders. Genetic load in families may be present in most cases. Heritability is present in schizophrenia and all schizophrenia spectrum disorder. Also in monozygotic and dizygotic studies, twin studies, we find that there is more risk with monozygotic twins. So genetic load is one of the main risk for developing the disorder.
Schizophrenia not always coming alone, sometimes come with comorbidity with other disorders, sometimes with drug abuse, sometimes with affective disorder, and they call it schizoaffective disorder. Sometimes coming with depression, and the association between depression and schizophrenia is a very long story. Sometimes in the prodroma of schizophrenia, the early presentation of schizophrenia coming like depression, not with psychotic or with hallucination in general or with delusion symptoms. Sometimes no, depression happening as both schizophrenic depression. After the schizophrenia will come the depression. Sometimes after the management of schizophrenia, the patient will have depression and he will remember what happened before and may he kill himself as a suicidal attempt. Why? Because he will come so incited. And for you as a psychiatrist, for the family also, they should notice these symptoms of depression are treated as early as possible, as quick as possible, because it's another major problem, whatever primary, not usually primary for schizophrenia, whatever it's secondary or just a comorbidity, because the issue of the suicidality in depression is very high.
Biological factors noticed from the some observations about drug treatment. So the main theory around the dopamine dysfunction. So all antipsychotics work on dopamine. Also there is some theories about serotonin, GABA, noradrenaline, and the other receptors and the new discovered one. Also psychosocial stressors, especially in the first 11 years of old. So some investigators accused mothers, what is called bad mothers and good mothers, as a responsible factor for developing most of psychiatric disorders. We couldn't ignore the marked stressors in the early life, which may affect a lot of the pillars of the personality characters, which may lead to some or the great differentiation of symptoms in schizophrenia. Also sometimes infection accused in psychiatric disorder, especially in schizophrenia, prenatal and perinatal complications also. Immunological incompatibilities also accused in as etiology in schizophrenia, but still not definitely known.
Treatment. Successful treatment of schizophrenia therefore depends upon a lifelong regimen of both drug and psychosocial support therapies. While the medication helps control the psychosis associated with schizophrenia, it cannot help the person find a job, learn to be effective in social relationships, increase the individual's coping skills, and help them learn to communicate and work well with others. Poverty, homelessness, unemployment are often associated with this disorder, but they don't have to be if the individual finds appropriate treatment and sticks with it. A person with schizophrenia can lead a happy and a successful life, but the initial recovery from the first symptoms of schizophrenia can be an extremely lonely experience. Individuals coping with the onset of schizophrenia for the first time in their lives require all the support that their families, friends, and communities can provide. Psychotherapy is not the treatment of choice for someone with schizophrenia, used as an adjunct to a good medication plan. However, psychotherapy can help maintain the individual on their medication, learn needed social skills, and support the person's weekly goals and activities in their community. This may include advice, reassurance, education, modeling, limit setting, and reality testing with the therapists. Encouragement in setting small goals and reaching them can often be helpful. Positive results are more likely to be obtained when group therapy focuses on real-life plans, problems, and relationships, on social and work rules and interaction, on cooperation with drug therapy and discussion of its side effects, or on some practical recreational or work activity. This supportive group therapy can be especially helpful in decreasing social isolation and increasing reality testing. Family therapy can significantly decrease relapse rates for the schizophrenic family member. Schizophrenia appears to be a combination of a thought disorder, mood disorder, and anxiety disorder. The medical management of schizophrenia often requires a combination of antipsychotic, antidepressant, and anti-anxiety medication. One of the biggest challenges of treatment is that many people do not keep taking the medications prescribed for the disorder. After the first year of treatment, most people will discontinue their use of medications, especially ones where the side effects are difficult to tolerate.
The prognosis usually in schizophrenia follow one of three lines. 10 to 20% they will improve dramatically, but they should continue treatment. 10 to 20% partial improvement, and again also they should continue treatment, and this is the maximum for them is the partial improvement. Around 40 to 60% they will not improve at all, but they should continue treatment to prevent further damage on the personality or more deterioration on that disorder the patient is having.
We can assess the severity level of schizophrenia and psychotic disorders, by the way, by using MMPI. What does it mean, MMPI? MMPI is some sort of important scale and important inventory. It's Minnesota Multi-Personality Inventory. It's tools to assess manic episode. It's tool to assess schizophrenia and depression episode, and how the level of schizophrenia, mild or moderate or severe or chronic or even acute. By the way, acute, it means that there is a severity of schizophrenia that the patient can hurt himself or even can hurt the people around him.
The biological treatment of schizophrenia, the antipsychotic medications usually plays the mainstay of treatment of clients with schizophrenia. The choice of antipsychotic actually depends on a lot of factors. It depends on certain clients' factors. For example, the biological status, the weight, the presence of other comorbidities, and it includes also certain drug-related factors. For example, the sedation properties of the medication. It may include also the duration of onset of the medication, as well as it also includes the patient choice of the medication. We have to work with clients actually in choosing the appropriate medication. I mean, we have to include them in the management options, as clients should always be reintegrated back to their community. They should always be reintegrated back to their lifestyle, because this is the mainstay actually of treatment of cases of schizophrenia. Clients should be integrated to community. Clients should be treated on community-based way of management.